In my personal opinion of when the diet should be introduced, I can understand some of the professionals going, try a drug first, maybe one, maybe two. The consensus statement says two. I can understand that. You can actually try 2 drugs fairly quickly. I think it should be no more than that. I think that the diet really does need to be, that's the absolute maximum. No more of this leaving it to the last minute or when 4 or 5 drugs have been tried. I think there are certain groups of patients, like the babies. I think the minute they have a seizure, it should be first line. I know that some will say that there are drugs out there that work better, or at the moment standard treatment is to try this drug first and then possibly the diet. But I think for the babies especially, because it's a lot easier to give a ketogenic milk of some kind. They're not eating, we can give it in a bottle. And families, I think, would be far happier with that because it's not too much different. It's like you're giving them a different type of milk than you would normally. And I think it would be easier for the families to deal with than having to consider put a lot of drugs in. So in my personal opinion, I think babies, the minute they seize, they should be put on the diet first. And I think the maximum we should leave before the diet's introduced is 2 drugs that have been tried and failed, which you can do within the space of a few months if necessary. But to me, that's the absolute outside, ideally, in an ideal world, that we should be doing it.